Here we are at part 5. We're in the urinary system, page 963. And we're looking at the general mechanisms employed by the kidney to clean our blood. And there are 3 things that the kidney does. Don't underestimate how complex any one of these will be. They will each be significant in the overall picture of things. So there's a lot to think about here ultimately. So we're going to be getting, again, anything that is of the liquid persuasion in the blood, and anything that's dissolved in the blood will come through. The formed elements and protein will not come through. So we should not find large amounts of protein here. We should not find red blood cells. Okay, so that's part of the program. If we see blood, especially dark-colored blood in the urine, we might suspect something going on with the kidney. If we see brightly colored blood in the urine, then that's a more distal feature, and there might be something going on with the urethra or the urinary bladder. So that would be a different matter. Alrighty then, so here we have our filtration, here we have our reabsorption, here we have our secretion, and they're listed in the color coding right here. Filtration is going to happen. Reabsorption is the way that we get everything back but still leave what we don't need for the urine. And then we can speed the process, add more to the urine that we had not gotten from filtration. What if we don't get rid of the acid enough? Actually, some of us have diets so rich in meat and wheat that we have such profound degree of acidity in the blood that we actually need to add some effort here. So a lot of people are adding a great deal of effort and secreting, spending a lot of time with active transport. Another active transport issue will come when we're using some kind of drug protocol. It could be antibiotics, but for people who have cancer and they must take very, how shall I say, strong drugs, there can be the enlargement of both the liver and the kidney due to the extra work that they're engaged in with that drug therapy. Okay, and then of course there's potassium. Because we're sparing sodium at the expense of potassium, potassium is also something that you could say is being secreted. And in that secretion, we're actually pulling back on the sodium and keeping it in the blood. Okay, so these are the main features of what is going on. Alrighty, because the pressure is so great and capillaries cannot normally withstand that level of pressure of 50 or 55 millimeters of mercury of pressure. Over here on page 964, they show us some examples of what's called podocytes. That is to say, the podocyte is supporting the wall of the capillary while at the same time not getting in the way of the fenestration so that the sprinkling of the liquid out can continue to proceed without any inhibition. Okay, we come over here and we check out how things are being estimated in terms of the blood pressures. Let's check that out. Again, I've mentioned that the afferent arteriole differs from the efferent arteriole in that it regulates blood pressure just by myogenic response. Just the smooth muscle here can respond to changes in blood pressure. So if there's a sudden increase in blood pressure, we'll get a little bit of constriction here to protect the downstream capillaries. When might that happen? It might happen if you're sprinting. You suddenly go into a sprint. Maybe you have to run after your child in the street and pull them back out. There's a lot of reasons to sprint from time to time, aside from just having fun. Okay, so they give us some arrows here. Here's an arrow going outward, which is the basic blood pressure at this level, 55 millimeters of mercury. Here we have the blood pressure from the Bowman's capsule back in is about 15 millimeters of mercury, pretty much what you would find in a venous system. And then we also have the pressure this way because we only have the fluid portion of the blood here, and we have the protein and the formed elements in here. So there's a lot of osmotic pressure. That's what the OP stands for, osmotic or oncotic pressure. So if you combine 30 and 15, you'll be looking at about 45. And over here we have 55. So we have a modest little 10 millimeters of mercury of pressure for getting the liquid portions out into the kidney for the cleaning procedure. So if you think to yourself about that, that's a modest, how shall I say, excess amount. The net here, they do the little calculation for you that 55 minus the 45 is 10 net on the way out, and that's not very much to work with. So that's, for that reason, things that go wrong in the body, especially low blood pressure types of situations, can be, how shall I say, challenging to the kidney. Okay, so then we press on to the next feature here, and I actually have to switch books, so I'm going to stop